Preterm babies are at risk for a number of complications. Although most preterm babies are healthy as they grow up, preterm babies do have higher rates of various developmental issues. This can range from learning disabilities or clumsiness all the way to the more extreme disabilities of mental retardation and cerebral palsy. Those generally affect the more extremely preterm babies, so there is a risk according to what gestational age the baby was born at. There are many causes of prematurity, and we don't understand all the causes of prematurity. There are many babies who are born early because the mother went into preterm labor, and there isn't a good explanation. There are some recognized risk factors, however. Mothers who have high blood pressure problems, especially a complication called preeclampsia, can deliver early. Mothers with diabetes may deliver early. Short interpregnancy interval, where one baby is born less than a year after another baby, is a risk factor for prematurity. Maternal health conditions are a risk factor for prematurity. Even without the preeclampsia complication, maternal high blood pressure is a risk factor. Maternal diabetes, as I mentioned, maternal obesity is getting to be increasingly recognized as a risk factor for prematurity, other health complications, and difficulties for both the mother and the baby. It may be that stress plays a role in prematurity. That is an area of research as well. And then there are some families where the babies are premature. There's a family history of prematurity. We're not exactly sure why that particular mother is at risk. There are some recognized obstetrical conditions and complications that do put a mother at risk for additional preterm babies. So certainly when a mother's had one preterm baby, that's a pregnancy that needs to be followed very closely.